Today we're going to work on Chapter 6, Pathology and Laboratory, in the CPT Code Book. As with many of our CPT chapters, you will use the index when you're looking up codes. You can either look up the specific name of the test, such as a urinalysis, the evocative suppression test, fertility test are examples, specific substance or specimen or sample that you are measuring, like glucose or CPK, which is an enzyme, cyanide. Your specimen would be from the bone marrow, from the nasal smear, or you can look up the specific method you used, such as culture, fine needle aspiration, and microbiology. So different ways that you can find these CPT codes. It's important when you're looking at labs that you also look at billing processes. In hospital billing, the charge master assigns those codes and charges automatically for any procedure that you have done. It's important that you know what they are and how to assign codes, but in a hospital, no one is going to sit there and code a lab. It is going to be in the software that the hospital is using. In physician billing, the coder has to determine if the physician performed the complete procedure or only a component of it. If you look at the components of a procedure, someone has to write the order, someone has to obtain the specimen, handle the specimen, perform the actual test, and analyze and interpret the results. So depending on how the facility is handling labs, one or several people could be involved in this process. In addition, there are payer guidelines that have to be followed for reimbursement. Like the insurance company might say they will pay for the lab for this, this, and this, but not for this. So there's definitely always payer guidelines that have to be considered anytime you're looking at reimbursement of lab and pathology. As you're reading these code descriptions, you will find quantitative and qualitative studies as part of the description. A qualitative screening is when you're just detecting the presence of something, either an analyte, constituent, or condition. And a quantitative study is when you are finding out how much of that analyte is in a specimen. So qualitative is the presence of, quantitative is how much. There are certain modifiers that you will use when you are coding in the pathology and lab section. They are listed here as well as in your textbook, as well as on the inside cover of your CPT code book. And you see I have in the far column on the right hand side who would be using those codes. For example, modifiers 22, 26, and 32, the first three, would be reported by the physician, but modifier 52 for reduced services could be reported by the physician or the hospital. And if you're looking at the modifiers on the inside cover of your CPT code book, the far left column is for modifiers for the physician. I have MD written in big letters at the top of that column in my book. The column of modifiers on the right hand side, the inside cover of your CPT code book, those are modifiers that are used by the hospital. As you continue down this table, you see modifier 53 is used by the physician, but 59 can be used by the physician or the hospitals. 90 is used by the physician, but 91 can be used by the physician and the hospitals. 92, alternative lab platform would be used by the physician. I've not used modifier 92, so I'm not really clear about when that would be used, but for testing purposes, it's always important that you know what your modifiers are. And remember, when you are sitting for a coding exam, you have your code books in front of you. If you're sitting for a CCS, CCA, CPC, different coding exams. For the RHIT exam, you do not have your code book sitting in front of you. What they have done is reproduce the answer selections as though you were looking at your code book, and we'll try to look at some examples of that through the semester. Laboratories are also indexed by the organ or the disease that they are directed toward. These are performed more commonly for specific diseases like hepatitis or arthritis, or specific organs like the thyroid function or the hepatic function. Hepatic is your liver function. All the tests listed in a panel must be performed for that code to be reported. And if additional tests are performed that are not part of that panel, those codes must be reported. And when some but not all of the tests in a panel are not performed, the individual CPT code should be reported. So if you want to look for a list of the panels that are indexed, you would look under the main term organs. Here's an example of an incomplete panel. This is not in your textbook. A physician orders part of a hepatic function panel, and the tests that he has ordered are serum albumin, a total bilirubin, a direct bilirubin, SGPT, and SGOT. What is the correct CPT code assignment? If the entire panel were done, you would look under blood test, panels, hepatic function, and 80076. But because we know that the physician only ordered part of the hepatic function panel, you would code those individual tests. And I found them by looking at pathology and lab as my main term, chemistry, and then the individual test, the albumin, total bilirubin, direct bilirubin, SGPT, and SGOT. I suggest if you don't know what those stand for, that somewhere in your code book you would write what that acronym stands for so you would know. A drug assay can be a therapeutic drug assay, a drug assay that is presumptive or definitive, the chemistry, and your codes that you assign are based on the purpose and the type of patient results obtained. Evocative and suppression testing is when the physician determines a baseline and then gives an agent and then notes what that effect had on the body. The description for each panel identifies the type of test included in that panel and the number of times a specific test must be performed. For example, in dexamethasone suppression, it's within 48 hours. This panel would include measurement of free cortisol in the urine twice, measurement of cortisol twice, and the volume measurement for timed collection twice. So it's very detailed as to what has to happen in order for that test to be completed. Surgical pathology is the unit of service known as a specimen that is taken during surgery and submitted for individual and separate attention. The surgical pathology codes are differentiated by 6 levels, and when 2 or more specimens are obtained on one patient, separate codes identifying the appropriate level for each should be reported. So you may see a code reported twice if 2 different specimens were submitted for. Codes 88300 through 88309 include the acquisition of the specimen, the examination, and the reporting of the specimen. Here's an example of a surgical pathology that's not in the textbook. Gross and microscopic examination of a kidney biopsy. You look under pathology and lab, surgical pathology, gross and micro exam, and you get a range there. And when you go and look at that range, you find the specimen that you're looking at within several options under each of those codes. The kidney biopsy is found under level 4, the CPT code 88305. Just for a note, the gross examination is when you are looking at your specimen without the aid of a microscope, and a microscopic exam, you are using the scope. Let's look at your first question in the review. Number 2, therapeutic drug testing for lithium. You would use therapeutic drug assay as your main term, lithium as your subterm, giving you an 80178. Number 4 is a confirmatory test for HTLV2 antibody, and your main term is antibody. HTLV2 is your subterm. Number 6, the gross and macroscopic autopsy, including the brain for a 72-year-old male. When you look under autopsy, gross and micro exam, it gives you a range of codes, and code 88025 includes the brain as part of the description. As with all of our CPT codes, you're always going to be reading all the descriptions found within that range to help you determine the best code. Number 8 is an HAI test. And you see here how you would find that code. HAI is hemagglutination inhibition test. Number 10, serum nickel testing to detect potential toxic exposure. Pathology and lab would be your main term, chemistry, nickel, or you could just look up nickel and also find the same code. Number 12, an antibody test for herpes simplex type 1. Looking under the main term of herpes simplex antibody, then you look at this range of codes, read your code description, and 86695 identifies herpes simplex type 1. Number 14, automated urinalysis by dipstick without microscopy. There's your code right there. Urinalysis is your main term, automated is your subterm. When you look at these two codes, one is without microscopy, one is with microscopy, and we select the code without microscopy 81003. Here's an example not in the CPT textbook. There's a good chance you're going to see this on an exam. A consultation was written for Dr. Sperry, clinical pathologist, to address test results and imaging studies to assist Dr. Henry, attending physician, with a difficult diagnostic problem. Dr. Sperry completed a review of the patient's history and medical records and submitted his consultation report to the attending physician. Your main term would either be under pathology and lab, clinical consultation, or under consultation as your main term, clinical pathology. When you read these code descriptions, you find 80502 is when the consulting physician has completed a review of the patient's history and medical records. That's all I have for pathology and lab. If you have any questions about this chapter, please post them in the discussion board in our course, and I will try to answer them. And I hope you have a good day.